During her weekly press conference, House Speaker Nancy Pelosi said health care reform will be paid for in part by, quote, squeezing savings out of Medicare.
The president said last night in his budget that he wants it to be paid mostly through Medicare and Medicaid cuts and savings.
Right.
Is it going to be possible to cut enough from Medicare and Medicaid to pay for the subsidies, which are it's 400% of poverty in both bills?
That's one of the ways that we paid for. That will be at least half the bill. Half the bill will be paid for by squeezing excesses out of the system, and there is $500 billion to do that, and we're looking for more. That can be achieved. Waste, fraud, abuse, redundancy, obsolescence, whatever it is. Squeeze it out of the system. And that means out of the providers and the rest as well. The second piece is the additional pay-fors. This bill will cost under $1 trillion over 10 years, but half of it will be paid for by cuts, will be taken care of by cuts. Less than half of it will be in finding other pay-fors for it. And to the extent that we can change the way health care is delivered and lower the cost, that's where we want to focus. But we will need some pay-fors.
Nicholas Balsi, CNSnews.com, the Capitol.